Little League players and baseball players are playing fall ball, spring ball, winter ball. So there's multiple seasons overlapping. In our day, you played baseball, you had 3 weeks off, football started. So there was breaks between seasons. And we're actually looking at studies showing repetitive injuries because youth athletics is becoming so intense and so much overlap. So today with us, we have Dr. Clay Wertheimer. And Clay's going to talk a little about Little League elbow, or what we call medial epicondylitis. Clay, any baseball experience growing up?
No, I was not a baseball player. I just wasn't coordinated enough to get that pitch to the catcher, and they just told me to leave.
So you never got to make that trip to the snack shack then?
Yeah, no, unfortunately.
So what is Little League elbow?
Little League elbow is elbow pain generally in a kid, and a kid that's throwing and playing baseball, and the bottom line is a kid that's growing. The growing elbow is different than the adult elbow because at the end of the bones are what we call growth plates, which are the source of how the bone gets longer. They're actually plates of cartilage that are rapidly dividing. And in a kid's arm or leg, it's the weak spot. So when they do stuff like turn their arm into a catapult, which throwing really is, and puts incredible stress on the arm, that stress gets transferred to the growth plates. Those growth plates get damaged, and the little leaguer's elbow starts to hurt.
So it's not only with pitching, but with any aggressive activities with upper extremity in young kids, they can injure this growth plate area.
Yeah, that's right. Any kind of repetitive activity, whether it's throwing or running, doing too much of a good thing can make those growth plates sore. And essentially what's happening is it's like a little micro fracture. The area is relatively weak. The stress gets concentrated there, and that area begins to break down.
So the growth plate, in addition, is the ligament in that area irritated a little bit too, in addition to that?
It can be, Shannon, but that's more typical of the adult or the mature, the teenager that's done growing. Then the forces seem to get transferred more to the ligament and the soft tissues around the elbow. The forces in throwing, just by the way, are mind-blowing.
Right.
Basically, a thrower is turning their arm, like I said, into a catapult and cocking it and then letting it go, accelerating it, and then rapidly decelerating it. And the elbow takes a lot of that force and consequently really gets stressed, particularly the inside of the elbow during the throwing motion. So the medial or inside really gets stressed.
So basically, in young kids, the ligament is essentially stronger than the growth plate. So the stress is going to be focused at the growth plate, and that's where the injury occurs.
That's right.
Bottom line. So what kind of signs and symptoms do you see in these young kids that are coming in your clinic and you're evaluating them?
Yeah, the first thing is pain. They hurt. A lot of the kids are tough, so they don't complain because they're afraid they'll get pulled out. So the second thing you'll see is a drop in their velocity, their accuracy, their effectiveness. And, that kid that was so good that was carrying the team suddenly is getting hit. He's losing his velocity and accuracy, and that's another sign to look for.
So these kids, when they're throwing, they're going to have pain.
Yeah.
So what is today's in today's world with increased technology, what is the treatment for these kids?
Well, the treatment basically is rest, number one. That's the treatment. And, of course, an ounce of prevention is worth a pound of cure, right? So the best treatment is prevention. Don't let that kid throw to the point where they're stressing their growth plates and getting pain.
When just out of curiosity, what ages are you guys seeing young kids?
Well, for me, Little League is 11 and 12-year-olds are coming into our clinic more now than I ever have seen over the last 20 years. And I think it's directly related to amount of activity and the amount of throwing activity that these kids are doing in a week. Would you agree?
Yeah, I definitely agree. I mean, I think it's the pitchers that are really getting the Little Leaguer's elbow, the kids that are up there throwing again and again. Again, this is a repetitive thing. It doesn't happen until you've done it too much and done it a lot.
There's some great information out there on websites. Do you want to address that regarding pitch counts?
Right, yeah. The pitch count varies depending on the age, and there was a great study done by the American College of Sports Medicine, and there's a website. You could just Google youth baseball and pitch count, and there are several websites. The American Academy of Orthopedic Surgeons has a website. I think you have information on your IRG website.
Right, we do.
And so look for that, because I can't remember. I have to look it up, but it varies depending on the kid's age. So 9 to 10-year-old pitchers, for example, they're only supposed to pitch 50 pitches per game. That's it, and 75 pitches per week. More than that, there's good science that shows you're asking for trouble and you're asking for Little Leaguer's elbow.
You're listening to Health Matters with Maury and Shannon on the all-new North Sound 1380 KRKO radio. We're talking to Dr. Clay Wertheimer, orthopedic physician from Everett Bone and Joint, about elbow injuries.
Clay, now, what if there is surgery for these, maybe not so much kids, but what about young adults? What kind of surgical intervention are they doing today?
Right. Well, for the young kids, the major intervention, as I said, is rest. That's a very important thing. Make the diagnosis, treat them, and rest them, and that will heal. But for the kids that are pushing through this pain and continuing to stress their elbow, who may be a little older, and damaging the cartilage surface in the elbow. Remember, the ends of the bone are coated with this white pearly stuff that acts as a great smooth running surface for the joint. And for those older kids that are whipping their arms around repeatedly, they can damage that cartilage, and that can cause elbow pain in a thrower particularly. And so in those kids, we sometimes have to go in arthroscopically and clean out that damaged cartilage, because it can break off and get stuck in their joint like a rock in their shoe. So that's one of the things we do. For the older, the teenage kid that has a ligament problem, if they have ruptured their ligament, which we're seeing now in older high school athletes and college athletes, then the best treatment for that, at least in males, is to reconstruct the ligament, because the ligament won't heal if we just sew it back together. We have to make a new ligament.
We have a call, gentlemen.
Oh, excellent.
Let's talk to Ron. Ron, you're on Health Matters.
Hi, Ron.
Hey, Sean. How are you doing?
Doing good. What's your question tonight?
My question is, my son's a 9-year-old pitcher in Little League, and he was asking his coach if he could throw sidearm, because he throws the ball better that way. And the coach said, no, you got to throw overhand. And I was curious if there's a reason why throwing sidearm's worse than throwing overhand.
Well, I'm going to take that first shot at that question. Basically, throwing overhand is much better mechanically for the shoulder and elbow, where throwing sidearm puts additional stress and torque on that medial side of the elbow, where you can irritate that growth plate like Dr. Wertheimer was talking. Clay, do you have anything to add there?
Yeah, I think that's true, Ron. You'll do your young man a big favor by allowing his coach to teach him good mechanics, throwing mechanics. And that'll take the load off his shoulder and elbow. And sidearm pitching is harder on the arm than appropriate overhead mechanics. And the mechanics have a lot to do with the stress. So even the type of pitch you throw. So if your young man is throwing breaking balls, I would discourage him from doing that and learn how to throw a properly thrown fastball and changeup. That's where you should focus on for your young pitcher.
Just one other quick question.
Yeah, go ahead.
How old should they be when they should start throwing like curveballs and more specialized pitches?
Hello? Did we lose Ron?
No, we're okay. We're back.
Ron?
Yeah. Did you hear my question?
Yeah, it was how old should they be when they start throwing curveballs?
Correct.
Okay, let me give you the rule of thumb that I use is they should have facial hair before they start throwing curveballs. That's kind of the rule of thumb I use, at least 14 years of age, because that's when their body can handle that curveball velocity and curveball mechanics. That's my answer. How about you, Clay?
I think that's a great answer, yeah. Over 14, 15, again, you want to make sure that they're strong enough and big enough to handle that increased load, because curveball and breaking ball, that's even harder on the elbow than the standard fastball and changeup.
Well, the coaches should be educated. They shouldn't be letting these kids throw curveballs.
Most Little League associations are doing preseason conditioning and safety meetings and educating coaches on the type of pitching appropriate for ages and number of pitches thrown per week. However, we all know pressure from parents,
right,
pressure to win, and pressure that coaches can put on kids. That's where the problem is.
And I do have a question. You said 50 pitches in a game. Okay, I'm down to the last inning. 60 pitches an extra day, 70 pitches an extra day after that? Or is it you get beyond the point of no return for reversing the effect of the Little League elbow?
That's a great question, and I think you do get beyond the point of no return. I mean, I think these guidelines are really should be followed because it's not like drawn out from a bank and you can pay it back later.
Right.
And so you want to. The bottom line is you want to avoid overusing these kids' arms.
So is Ron still on the phone?
No, he went.
Thanks, Ron. Thanks for your
Yeah,
call.
thank you, Ron.
Yeah, Clay, so we were talking, an older athlete that has stretched out their ligament and you have to reconstruct that ligament, that's called a Tommy John. Is that right?
How old are we talking about, by the way, older athletes?
I would
High
say
school?
18.
18, 19.
18 and older, yeah. At least your age, Maury.
So they're done growing, and they're now in a level where they're probably pitching year-round, those kids. So, the ligament is that thing that holds the bones together, right, and adds stability to the joint. And the ligament on the inside of the elbow is the one that really, really gets stretched out as these guys are throwing. It gets stretched out. It's amazing what they've found. The scientists have found out that the failure point, the amount of force that takes to break the ligament, is higher than the amount of force that the arm generates when they measure these guys throwing. So why don't they all break their ligament? The reason is because their muscles add a level of protection.
Stability.
Exactly. Mm-hmm. So it takes the load off that ligament normally. But if the muscles start to poop out, then you're hosed. Then the force gets focused on that ligament, and that ligament breaks. And a lot of these pitchers will say they felt a pop, and then they have nothing, no velocity. So I just say that to emphasize the importance of muscle strengthening and conditioning in these athletes. Mm-hmm. But as far as the ligament goes, when that thing breaks, at least in male athletes, there is some evidence in females, maybe it can heal. But in male throwers, it needs to be reconstructed, and that's where the Tommy John thing came in 1974. Was the first time it was ever done.
Named after, I did some little
Tommy John.
Named after Tommy John, pitcher, major league pitcher.
Maury's got some facts.
I
Facts
do.
by Maury.
Right.
He pitched for 7 teams.
Which team was he pitching for when he tore his ligament? Do you know?
Was it the Yankees? No, the Dodgers.
Dodgers.
It was on the Dodgers.
Yeah.
So he had surgery. Dr. Frank Jobe is probably like the god of your business, right?
Well, he's a very well-known guy,
Yeah.
and he really made orthopedic sports medicine history by doing this particular operation.
So it was the summer of 74 when he had this surgery. He sat out 1975. He came back in 76. He went 10-10 in 1976. And the odds back in those days, I was reading on this, there was a 1 in 100 chance that he would come back. I mean, it was amazing, the odds of him even, because it wasn't done before. He won 20 games in 1977. Tommy John won 288 career games. And after surgery, he won 164 games. He played to the age of 48.
Wow.
Yeah.
So, yeah.
That's pretty impressive.
Before this operation was done, if you were a pitcher, this was fairly common for pitchers to tear their medial collateral ligament in their elbow or ulnar collateral ligament, and you were done. That was it. And that's one of the reasons why Job said, okay, I'll do this, because really you have nothing to lose. You're done anyway. If it doesn't work, you'll still be done. And if it works, well, maybe you'll pitch again. And I think actually at the time he did the surgery, Job, the doctor, said, I think your chances are about 1 in 1,000 that you'll be able to get back.
Right, yeah. See, and nowadays, they say that's an 80 or 90% success rate?
Yeah, there's a published, it's about 83, 84% success rate, which is pretty awesome when you think, holy smokes, what these guys do to their elbows.
Well, here's who have had Tommy John surgery. Eric Bedard, pitching for the Mariners. A.J. Burnett is on the Yankees. Jose Canseco, well, there,
Yeah.
B.J. Ryan, and there's a list goes on and on and on. So there's a lot of guys, a lot of baseball players, and a lot of football players who have had successful Tommy John
Drew Brees,
surgery.
did he have a Tommy John? Some quarterback in the NFL, Drew Brees, came back from a Tommy John.
Yeah.
So you can see it in anybody that throws extensively, quarterbacks, pitchers, etc.
I think too, back in 1974, when none of us ever heard of any type of surgery, that kind of made us aware of ACL and MCL and all that stuff was more common knowledge now. Now, because of, football season, they'll say, hey, somebody tore an ACL. Oh, everybody knows what that is. Back in these days, we didn't know what it was. So.
Right. What is the post-surgery expectation?
So that's why Clay Wertheimer's a rock star now.
Yeah, absolutely.
Yeah, because of that.
Absolutely. So post-surgery, these Tommy Johns, what is it, 4 to 6 months, 6 to 9 months? What are we talking here, Clay?
Yeah, basically, you have essentially a year, 9 to 12 months until you can be 100% if you're at that level that you're a major league pitcher. It's a long rehab, but the success rate is pretty encouraging. Over 80% do get back to that level with the rehab. And
it's pretty tough to brace an elbow, isn't it? Particularly if you're going to throw with it, you can't put it in a brace,
exactly,
some kind of a sleeve or anything like that. So
So what they do is they basically take a tough piece of tissue from elsewhere, either from their wrist. Most of us are born with an extra tendon that can substitute for this ligament. For those that don't have that tendon, and they're about 20% of the population don't, then we take part of their hamstrings on the not their push-off leg.
Sure.
And then reroute that piece of tissue into the elbow, connecting the two bones to once again stabilize the elbow.
So you're just providing an additional piece of tissue that to the elbow to give it extra support.
Exactly. It's just like a rope holding those two bones together.
That's amazing.
Sounds like it hurts.
It probably does. So just to recap real quick, because we need to go to a break here. If your child, little leaguer, has elbow pain and complains of pain with throwing, you need to stop that activity. Is that right?
That's right. Rest. And if the pain doesn't go away with a reasonable period of rest, then you need to get that young man or young woman evaluated.
Absolutely. Get him in. Let someone take a look at that elbow pain, particularly if it persists.
Clay, thanks a lot.